Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that remote. This is one of my most important shows of the year. Now, you call your uncle, your aunt, your mom, your gumbadis and gumbadis. Get everybody, come to the TV, okay, and watch this show. And this month is Heart Month, okay? So much about the heart. You know, when they play the Star Spangled Banner national anthem, you put your hand over your heart. When the parade going by and an American flag is passing, you put your hand at your heart. And so the heart is so important. You know, it keeps boop, 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 keeps going. And my guest today, we're going to talk about the heart, okay? And I can say that I know a little bit about it because I have a pacemaker over here. I used to be over here, but over here. But that's like a guy, he said they had a nose job. He said it used to be over here, now it's here. But there's so many songs that are written about the heart, okay? Let me call you sweetheart. I left my heart in San Francisco. Peg of my heart. Achy. So all these songs about the heart, you know? And I did a little research on it. But you know, there's no songs in all the Christmas carols. It's nothing about the heart because it's about the soul in Christmas. So, without all further delay, we got 15-round fighters, you know, right here, top shelf. My doctor, Dr. Belasco, who I had a hip operation, and they told me my heart was going boop, 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 boop. It wasn't going fast enough. And after the operation, they told me I had to get a pacemaker. And he leaned over and says, I think you better. It'll help you, Hank. I said, okay, Doc. So, welcome to the Hank Show. Now, you take over. Tell me what this show's all about.
Primarily for this show, I wanted to have all of what we now have available from a cardiology standpoint in Norristown. I've been practicing in Norristown for 34 years, and although the last 10 years to maybe 15 years we've had cardiac intervention with angioplasty and been able to treat our heart attacks with emergency angioplasties and stents, we didn't have open heart surgery and we didn't have some of the other things that are currently available. Now with Einstein having partnered with Montgomery and basically building the new hospital, which is on Germantown Pike, we have basically everything that we need in Norristown. There's virtually nothing we would have to refer a patient out of Norristown for cardiology other than maybe transplant at this time. We have all of the non-invasives that we've previously had with cardiology, which Dr. McGargy is going to talk about. We have some additional modalities which he can do, which we didn't have before. We have electrophysiology things which we're not going to talk about today, such as defibrillators and ablations. And the big prize of all is we have Dr. Anderson. We now have world-class heart surgery right here in Norristown for our community. So I'm going to let them discuss their specialties.
Let me say something about Dr. Anderson, okay? Dr. Anderson is a heart surgeon, okay? He's the one that, I was talking to another doctor that does operations to the veins and all, and he says, you know, heart doctors are special people. I guess there's something like test pilots in a plane, you know. Everything has got to be right, and sometimes they can be a little cranky because do this, do that, and make sure everything is on the ball. So I would say that a heart surgeon is a special person, and I have to congratulate you or I would have bowed to you, whatever. I'd say that we need people like you. So, okay, now, I just want to throw that in there, ladies and gentlemen, let you know how important the heart, because what good's a car without a motor? Go ahead.
Well, I thank you very much. That's very kind of you. But I think that physicians in general are special people. Most of us now are doing this because we really like what we do. We care about what we do, and it's really our lives that we made a decision about doing this a long time ago. So maybe not just heart surgeons or cardiologists, but I think all physicians are the same. But yes, heart surgery and interventional cardiology can be, you can be in a life and death situation. And
let me ask you one thing. When you have to operate on the heart, do you stop the heart? Tell me.
Sometimes we do. Sometimes, actually, the heart-lung machine was created a long time ago. Interestingly, the first heart-lung machine was another human being. But where a mother and a child were able to utilize their circulations, or the mother's circulation for the child, in what was known as cross circulation, to in essence function as the heart-lung machine. But then mechanical devices were developed, and over the past 50 years we've developed a machine now that is able to support the heart and lungs and your physiology for hours.
While you're operating.
Mm-hmm.
Oh my God. But now, there's a difference between transplant and a heart operation. What's the scoop on that?
Well, transplantation is now reserved for patients with end-stage heart failure that are, there's nothing more that Dr. McGargy could do, or I can do, or Dr. Belasco can do to make them better or get them out of heart failure such that they can function without significant limitations. So the only way to get their circulation back to normal would be to replace the heart. So in that setting, when a donor heart becomes available and the patient has been seen and entered into a transplant program, and then the donor heart becomes available, the whole native heart is removed and a new one put in.
Yeah, well, I have my son-in-law's father had transplant, but in Philadelphia, but he was in Montgomery Hospital. And they took him to Philly to do it, and 15 years. He just passed away just about a year ago, and that was 15 years ago, and he lasted. And now, 15 years later, there's a lot more advancement, right?
Yes,
what are some of the
there
things
is.
up
And
front?
Well,
I want people to feel that, hey,
well, heart transplantation.
there's help out there.
Heart transplantation is still the gold standard, the best therapy we have for end-stage heart failure. However, there are some new therapies that are coming down the line where the results are starting to become equivalent with transplantation, and primarily that is the mechanical circulatory devices that have been developed, which are basically pumps, mechanical pumps that are able to circulate the blood, and now are very small, very durable, can last for years and years, and the big bonus is that you don't have to take all the medicines that you have to take for transplant to prevent rejection. With the mechanical pumps, you don't have to take any of those, maybe some blood thinners, but when you look at the side effects of the two, the immunosuppression drugs by far are have a much more significant side effect profile. So, and mechanical devices are readily available. Yeah. So it's going to be a change with respect to how we manage this.
Not all operations are cutting open. I guess this is where you could come in, right? Where they don't necessarily have to cut you open. They find other ways. Show me some little stuff that they go and find its way through there.
My role between
the Suez Canal.
My role between Dr. Belasco and
Yeah,
Dr.
that's.
Anderson,
In other words, he's
I'm
a
the
lookout.
go-between.
He's the lookout man. He sees to make sure that there's something there, and then needs investigation and needs an operation or whatever.
Yeah,
right.
we're
So
both,
it's 1, 2, 3, right?
We're both technical support for Dr. Belasco and the rest of our partners at the hospital.
Well, what is it? Is this a team?
It's a team approach.
Oh, well, tell me that. How's it start?
So it starts with a patient seeing Dr. Belasco in the office for a problem, say chest,
Like me.
Yeah, chest
I went
pains,
there. Right.
Chest pain, shortness of breath, and then heart testing's done, an echogram, maybe a stress test, and if that came back unusual or abnormal, then on occasion the next test is ordered, and that's what I do, and that's the heart catheterization.
And I hear so much about the catheter. Tell me what that
The catheterization, years ago, we would only go in the leg to do it, get back to the heart through the leg blood vessel. These days, we now, more than half the time, are able to go in right here with a little tiny catheter and go back around to your heart.
And it's all the way up to your heart.
And through that little opening, we can fix blockages with balloons or stents. And I have brought some samples for you.
Well, let me
look
see.
at. Okay.
You know, we got to get there.
So the first sample
I hear
show
the
you.
stents. You know, I don't know what it is. Tell me, ladies and gentlemen, this is educational.
So
and we're making home visits. You know, doctors don't come to your house, but we're coming in your house now.
So if somebody has a blockage that is to this degree, which
Well, that okay.
is a pretty severely blocked artery, And the yellow stuff is plaque and cholesterol and fat clogging up the artery.
In other words, the blood has to go through here.
Yeah,
And
through that real narrow opening, when in the past,
that's what it's supposed to look like.
it's supposed to look like this one, with a real big
Oh,
opening.
my God, yeah, okay.
So, you know,
Can you get a good shot on that? In other words, this right here,
that's a normal looking
and
artery.
over here, can't get through.
And
So,
then on this one, this is a
and that's
really
more, right?
blocked artery.
Nothing.
So if an artery is blocked like that, we can normally fix it with a balloon to open it.
What do you open, like here?
Yes, we go through the middle with a small wire, over the wire, slide a balloon.
You got that wire with you?
I have something like the wire. I'll show you
Okay.
that one in a minute. And then after that, we are able to actually place a little metal spring called a stent,
Can we
which
get
you
a
can
shot
see
on that?
there. You can see
That is what you call,
that's a stent.
and that's placed in there, the whole glass thing here?
No, just the little metal piece in the middle.
Oh.
The little metal spring in the
Oh,
middle.
okay.
Yeah.
Oh, I see. It's like a little spring.
Yeah, Chinese finger slinky kind of thing.
How about that? Yeah.
And those we place in the heart for blockage, to open the blockage and keep it open. And then that stays in the person's heart to keep the pipe open.
That's small.
That's small, 2 millimeters to 4 millimeters, so real tiny. And then if a person is had blockage, hardening of the arteries for a long time, there's a tiny device called a roto, which is a high-speed drill.
Hey, whoa, roto, what do you mean? My sewers clogs up out front.
It's just a
Roto-rooter.
small roto-rooter, and this we use to clean out the inside of the pipe, to open a larger channel to make it easier to put the little metal stent in. So we have all
God.
kinds of tools now.
That is round. It's almost like a lady's thing when she puts it
curler?
on her hair.
Curler,
What do they
yeah.
call that?
A
Something.
curler?
Yeah. And that keeps people alive.
Keeps people alive. It prevents heart attacks
You put this in without the big cutting open?
without cutting open. Just a little tiny needle puncture is all you need through here, or sometimes through the leg artery.
Whatever.
Yeah.
If the person is heavy set or so, it becomes a problem. That's why you want to keep
if it's a heavy-set person, often it's easier to go in through the wrist.
Okay, I see. Yeah.
Yeah.
I say that.
The arteries we're talking about are these coronary arteries that are on the outside of the heart, and they feed the heart muscle so it can keep beating. Those are called coronaries. And the arteries where Dr. McGardy's talking about placing the interventions, the balloons to dilate them open, and stents or a router to open up a completely blocked artery. And then Dr. Anderson also has a number of techniques.
Yes,
involving this same
if a
thing.
person is too sick for me to fix and they have so much blockage that I can't do it, then I call Dr. Anderson, who actually, he works right next to
Come in
me.
the bullpen.
He works
He's a relief pitcher.
right across the hall, and I'll walk across the hall and find him.
But you keep, in other words, if you go into this procedure, you keep him alert, just in case.
Yes,
It's a time
standby.
frame there?
Standby. He's on
Standby.
standby just in case.
See, that's what I'm saying about your special guy, that you got to be tense all the time. The same thing with a policeman, you know. When I was on a patrol, and it's a tension. You're driving, all of a sudden, car number 8. As soon as that, I get, what is it, you know? Car, child hit, Marshall DeKalb Street, you know, and your adrenaline starts moving. So you got to get yourself together. Oh my, go ahead.
Well, fortunately, they very rarely get into trouble and need to call us emergently. But what he was mentioning, I think, is how we collaborate now. And in the current era, I think collaboration is like never before. We work together very closely with respect to looking at a patient, deciding what the right thing to do is, deciding whether or not we can each do something that maybe we can optimize or give the patient the best possible product, so to speak, which combines something that I do along with something that he does. And hopefully we can avoid often the major open heart surgery, and he can do a percutaneous or the needle puncture and fix something, and then I can do a less invasive cardiac surgery procedure such that we can completely solve the patient's problem with what I view as really the 21st century type of intervention.
Well, now, Doctor, never did this at Montgomery Hospital, right?
Well, we had, when somebody came in with an acute heart attack, we had the emergency intervention to do with the stent and open up the culprit artery.
At Montgomery Hospital?
We could do that at Montgomery, and we could do them semi-electively. But we didn't have remotely the type of things that we now have available. For example, I had a patient who had a blockage that was best taken care of surgically rather than with a catheter technique, and it was a single blockage in the front of the heart, more or less in this artery here, the left anterior descending, and Dr. Anderson, I'm bragging for him, was able to go in, make an incision this big between the man's ribs, not through the breastbone, take down an artery from under the chest, attach it over the blockage, and the guy's back to work in a few weeks. He was out of the hospital in about 4 days. It used to be people had big incisions from here to here, and of course some of them still do need those big incisions, and would be feeling pretty lousy for 4 to 6 weeks until the wounds all healed up and they got their energy back and probably wouldn't get back to work for a few more months. And it's for me, having been in practice 34 years, it's sort of miraculous what these guys can do, respectively, for my patients. I basically feel like I'm the quarterback and I just toss in the ball. And some of the stuff I manage, just giving medications and cardiac rehab and exercise and diet and doing the diagnostic testing and the following along is my role in it. And then when there's something or other is occurring that I can't deal with just my prescription pad or dietary changes or exercising, I've got tremendous ammunition sitting here as Hank in the bullpen.
You know, what's this little trapdoor here? Doc, you're the guy that has to open them. What's the scoop on that?
Well, this is something, and maybe Dr. Belasco or McGargy can talk about it. This is the right atrium. There are 4 chambers of the heart, being the right atrium, right ventricle, left atrium, left ventricle. The atria are really the chambers where, on the right side, the blood comes in from your upper body and lower body into the right atrium. And then it goes through the right ventricle into the lungs where the oxygen is added, and then it comes back into the heart to the left atrium and into the left ventricle, which is the main pumping chamber, and then out to the body. So this structure here is known as the auricle or the appendage, and there's one on both sides, and they're interesting because they really don't serve much of a function, actually. But they can cause problems, or the atria can cause problems, primarily when we have an irregular rhythm. And the most common one is known as atrial fibrillation.
What do you mean by what's that? It's not hitting on all cylinders.
Well, it's just like a quivering, as opposed to the normal contraction that we have of a normal sinus rhythm. Atrial fibrillation is when you get this kind of chaotic rhythm. Right. Or contraction of the atrium. And it's a very common condition in people, and I think there's a lot of new things to treat atrial fibrillation and try to get people back into sinus rhythm, and some of them are being done at Montgomery Hospital. A lot of them are being done with some of Dr. McGargy and Belasco's partners in terms of using energy sources and ways to actually map the heart and find where the source of this irregular rhythm is coming from, and making it go away and getting patients back into sinus rhythm. So I like to think of the new hospital that we have here as I'd like to make it into one big cardiac center, but I really think it is now a cardiac center in that we have very advanced interventional cardiology, advanced cardiac surgery, electrophysiology, regular cardiology. So I think that there's, as Dr. Belasco said earlier, there's no reason that really almost any cardiac condition can be treated there.
But I saw in the Philadelphia Inquirer where Einstein has 2 or 3 hospitals, right? In Philly, And Montgomery Hospital, Montgomery Einstein here has the highest rating. So we're doing very successful as a new hospital coming on. And that means because people like you are making this, being successful in the area, and people feel confident to come to this hospital. And so now, tell me something about yourself. You wasn't born a doctor. I wasn't born a police officer, right? Tell me something about you. What makes a heart doctor?
Well, I always say it's because my mother told me I was going to be one. No, I honestly, I always wanted to be a doctor. I can't imagine ever.
What did you do?
I
What did
never
you do to,
wanted
like,
to be
did you
anything
play with
else.
doctor, or cutting things up, or what?
I don't know. Maybe it was watching Medical Center or the Marcus Welby, which is
That's how
you remember. So I don't know. But honestly, it was
How about
always
anybody
something
in your family
I
doctors?
I have some. Yes, I have some relatives, not in my close family, but some of my relatives are physicians.
And so what kind of training did you get? To be
Well,
a heart doctor, what
very
kind
same. We've all did essentially the same thing. Meaning, we went to all the way up through college to medical school. Then we did residencies in medicine, in cardiology, and then we did specialty training in interventional cardiology. I did cardiac surgery, and a lot of this spanned many years after we left medical school to get to where we are now. But interestingly, I had a mentor of mine, a surgeon, and one day we were going in to operate on the patient, and the patient said, you know, you're not going to let this to the chief of surgery. You're not going to let the student operate on me. And he took her hand and said, my dear, we're all students. Meaning that we continue to learn new techniques and new technologies and how to treat people. Still, you know, we continue to evolve as physicians. And one of the nice things, again, at Montgomery is we've been able to bring in all the new technologies, all the physicians there. One of the reasons why I think it's rated so high is because you have a great population of physicians, well-trained, highly skilled, with new technologies there.
So part of the team. Tell me something about you now. Now.
I grew up in a doctor family.
Oh, yeah?
Yeah, my dad was a doctor,
What kind of doctor?
pathologist.
What's that? Baby doctor?
No, autopsies. Dead people.
Oh, my God.
Yeah, so he
We're
worked.
going to talk about the dead.
Well,
Well, with that in mind, sort of broke the ice a little. And then I had an experience growing up that really hooked me. And that was, my dad was drafted, and we lived on an Army base.
Where?
Yeah, Fort Sam Houston, and then we lived on an Army base in Missouri, Fort Leonard Wood.
We're
And
we're
in the
President
middle-
Truman, right?
Right, middle
I
of
was
nowhere.
down there. It's Independence, Missouri, man. You ever get the chance to see his museum there?
The Show Me State. So
Great guy.
my brothers and I were out in a field catching snakes. And the snake bit my brother. He handed it to me. It bit me. Our hands swelled up. And we were
my
like,
God.
uh-oh, 12-year-old boy, this can't be good. Put the snake in the bucket, brought it back home. My mom couldn't believe we brought the snake home. She drove us up to the little hospital on the Army base. And the medic asked what happened. We said, the snake bit us. He goes, where's the snake? We show him the snake in the bucket. He goes, oh, that's a copperhead.
Oh, my God.
So poisonous snake. And then at that time, they gave us anti-venom shots. And so I never got sick from the poisonous
You
snake.
caught it in time.
Yeah, they caught it in time.
Well, what did it do? You're supposed to get it, suck it out or something? That's what I see that.
I
I see
don't
the
know.
cowboys to do that.
I
you
don't know, but it just really intrigued me that they could just have the antidote and fix the problem
Just have it right there, yeah.
Yeah.
I remember there was a case here in Norristown where a guy owned a bar there on Brown Street, and about 2 o'clock in the morning, they had a couple of drinks on it, I guess, and they went down to the zoo in Norristown. They put his hands in the cage, and I think the bear, and next thing you know, he would start cutting, and they were looking all over for some kind of medicine stuff. Finally, they got it from Chicago or something. They sent it, and they cut the arm up to here until they would get the whatever kind of medicine to stop it. See,
Wow.
but you were lucky then, right?
Very lucky, yeah.
Right.
But that's sort of what hooked me into being intrigued with medicine.
How about your family? Your dad's still around?
No. Cancer unfortunately took him 4.5, 5 years ago now.
Oh, yeah?
So, yeah.
Yeah, you know, Doc here, when I had this pacemaker here, then he looked at it and there was sort of an infection around the side, and he said, well, we're going to try to save it by medicine, but it didn't work. He says if the infection is below the pacemaker, then you got a problem. So thank God they got it, looked at it, and the infection was around the outside. It wasn't underneath. And then so they got it and they put it over here. So last 2 weeks ago, I went over to get checked out for a pacemaker with Dr. Tim and the girl, and the girl put it over here, and she says, "Oh, I get excited," and then found out that this was the old place. She was looking here, I couldn't find no pacemaker. It was over here, you know, but it was really good. But you know, we've been here for a half hour. We talked about, I think we covered just about everything. Is there anything you want to just mention? We're closing up this couple minutes.
I just think it's very gratifying now to have the opportunity, for me, when my patients need to have these interventions done, that they're done right here in town. I don't have to send them out of town. I get to participate in their care after the surgery, not during the surgery, but certainly after, and be involved in their care right from the beginning without having to just basically farm them out to another institution like we'd had to do for most of my 35 years. So I'm just unbelievably excited about what we have available now right here.
Thank you. How about you? Closing remarks.
I think that it's exciting to have cutting-edge technology at your fingertips. And my job and Dr. Anderson's job, we like our toys, and this institution has supplied us with the best new tools that we need to do the best job in complicated situations to fix hearts. So it's very exciting having all those tools in the box. Yeah.
Well, Doctor?
From my perspective, it's great to be part of this team. It's a collaborative thing between us and cardiology and interventional cardiology, and we're able to take care of patients now that historically were sent home. We're talking about older patients now, 80-year-olds, 90-year-olds. We're able to fix them, to give them, to improve their quality of life, improve their survival. So to me, it's just very gratifying to be a part of this team, to be able to collaborate, and to be able to do it in the new facility that we have. It's been very exciting.
Well, let me tell you, this half hour is really good. And then I was telling you about some of the songs here. Peg of My Heart, Who's Sorry Now, Baby Face, My Poor Heart is Jumping, You Sure Started Something. So all these here songs about the heart. So have a heart, and I'm sure we all got a heart, right? That's like the guy says, when you're driving home, make sure you have a car. Oh, well, that's a Social Security joke. You'll get it when you're 65. Okay, ladies and gentlemen, thanks a lot for allowing us to come into your home, and I hope that this program enlightened you about what we have available and the people that we have that are here to help us. Einstein Medical Center, Montgomery, okay? So until we meet again, keep bobbing and weaving, keep your trunks off the canvas, and God bless each and every one. And as Lawrence Welks would say, keep a song in your heart. And Hank Cisco says, check with your heart doctor. Okay? So thank you very much. Grazie. Okay.
Like
Alla salute. Ready? Let's go. To your health. Alla salute. Ready? Boom.